Hi guys, welcome to my channel. My name is Handover, and in today's video, I'll be sharing what a typical shift look like in the ICU, both day and night shifts and all the activities that we fill them with. First, thank you so much for clicking on this video. Please don't forget to hit the like button and it lets me know that you're enjoying the content and keeps me motivated to keep doing videos like this. Just a quick disclaimer though before we dive in, I haven't worked in every NHS ICU in the UK. I'll be using the routine and structure from the trust where I currently work as an example. If you are thinking of transferring to ICU or planning to work in an NHS critical care setting, I hope this gives you insight into what to expect. Alright, let's dive in. A typical day shift starts at 7:30 with handover, which would usually wrap up by 8 o'clock. However, it might take longer if the patient is very unwell or if there's a lot of information to share. ICU handovers are very detailed. This is where you learn about your patient's personal data, information, diagnosis, past medical history, and a rundown of all the latest observations, interventions, and other information on the flow sheet. It also gives you a chance to jot down key tasks, identify any risk that needs to be acted upon or escalated, and prep for ward-round discussions. In the ICU where I work, we go straight to the bedside for handover, while in some ICUs, they have a general handover before the bedside handover. At 8 o'clock, we do a bedside safety check. This includes making sure that the IV pumps are working and charging, checking the airway emergency bag and making sure it is complete, confirming monitor and ventilator alarms are on and within appropriate limits, zeroing the arterial line, ensuring oxygen and suction supply are working, verifying tracheostomy kits and emergency boxes are at the bedside if applicable. We also carry out a very detailed A to E assessment, so airway, breathing, circulation, disability and exposure, to get a clinical overview of the patient and note anything that needs escalation. By 8:30, we do a SAM or a huddle depending on the bay coordinator. It could be at 8:45 a.m. as long as it's done before 9 a.m. SAM is short for Situational Awareness Meeting. It is basically a huddle where the nurses and other members of the MDT, if present, gather together and escalate things. So every nurse talks about their patient briefly and escalates how many people they will need for a role depending on how sick the patient is. You should escalate if the patient is going for an investigation, especially when you're not transfer trained. You should escalate if your patient is going to undergo a bedside procedure and you're not familiar with it or you need help. You should escalate if your patient is going to the theaters or being discharged to the ward. You should escalate police password or family passwords and any other thing you feel other members of the MDT should know. This helps the bay coordinator or the floor coordinator know how to allocate human resources for the shifts. This is also the time the bay coordinator decides how we go on break and who is covering who. By 9 o'clock, we begin roles or repositioning. Roles are taken very seriously in the ICU. As most ICU patients are very dependent, a 2-hourly or 4-hourly role is needed for the patients to help prevent pressure damage. This time is also used as an avenue for personal hygiene. We provide oral care, high care, and back care during this period. By 10 o'clock, the ward round begins. The whole MDT along with the floor or unit coordinator moves from bed to bed to discuss each patient and make a plan for the day. This is also an opportunity for the nurse to bring up any concerns that he or she might have about the patient and get it addressed. Between 12 o'clock and 2 o'clock, we start our lunch break, which lasts for 40 minutes. By 1 o'clock, we have the second roll for the shifts. By 15:45 or 3:45 p.m., we should have a second SAM for the day. Well, the aim of the second SAM is to look at the things that have not yet been achieved and how we can go about achieving them. Though we don't always have a second SAM, it just depends on how busy the shift is and sometimes there's just no time to get one done. By 4 o'clock, usually the evening ward round will begin. Between 4 o'clock and 6 o'clock, the evening break starts and lasts about 20 minutes. By 5 p.m. in the evening, we have the last rolls for the shift. And at 7:30, it is handover time. This is basically the schedule or routine for the ICU I work in. In between all this routine, you would be administering medications, going for investigations or transfers, doing ABGs, making changes to the ventilator according to your ABG results, drawing up bloods for lab, allowing relatives to come in to visit their patients, helping doctors with intubation, extubating patients, documenting hourly vital signs, doing sedation holds, hourly inputs and outputs, and also other things that need to be documented. Also, during the day shifts, the nurses will float, do the airway trolley check, the defibrillator trolley check, hypobox check, oxygen rack check, stack transfer check, and other checks on their to-do lists. The night shift kicks off at 7:30 p.m. in the evening with handover. By 8 o'clock, we carry out the bedside safety checklist and A to E assessments. By 8:30, we have the SAM, and by 9 o'clock, we start rolls or washes. We like to give a full bed bath at night in my ICU. You can give a bed bath either at 9 p.m. or 5 a.m. in the morning. You can also give one at 1 a.m., but it's not always convenient, so most people will either choose 9 p.m. or 5 a.m. If they are level 2 patients, they will have their baths or washes during the daytime, except they specifically ask for it at night. By 10 o'clock, ninth ward round starts. Between 10 o'clock and 11 o'clock, we start having our first break. Sometimes it extends to midnight when it's a very busy shift. By 1 o'clock, it's time for another set of rolls of washes. Between 1:30 and 4:30, we start having our second break. By 4 o'clock, we start to take and send routine bloods. For most patients in the ICU, they'll need to have their bloods taken and sent to the lab every day, especially for like full blood counts, electrolytes, urea and creatinine, and coagulation. Additional samples could be sent if requested by the doctors, like say drug levels for aminophylline or vancomycin, if they are like vancomycin infusion and other kind of tests. By 5 o'clock, we have a second SAM, if able to. Then we have the last set of rolls for the shifts. By 6 o'clock, we are changing the suction tubing and canister. The canister might be full from all the suctioning that has been going on through the day and night, and this should also be like part of your VAC bundle. We also drain the urinary catheter bags and other drain bags that might be present, such as wound drains and all that stuff, or maybe NG drainage bags if present, as they usually would be full by this time. Also, this doesn't mean that you can't change it at any other time of the day if they are full. You also want to check which one of your lines need to be changed, like let's say the arterial line transducer, the urinary catheter bag, the anchor fast, and closed inline suction, as this will be a good time to change it. And finally, by 7:30, it is handover time. Yay for the night nurse. In between this schedule, you'll be doing other stuff like administering medications, TPN, NG feed, doing ABGs and other things. Also at night, the floats do the airway trolley check, the defibrillator trolley check, hypobox check, oxygen rack check, stack check, and other checks on their to-do list. And the bay coordinator makes sure the CD check gets done and CDs that are depleted are ordered in the CD request book so that the day shift gets to send them in the morning when the pharmacy is open. I hope you found this video helpful and insightful. If you did, please give it a thumbs up and subscribe to my channel for more ICU content. If you have any questions about ICU life or topics you'd like me to cover, feel free to drop them in the comments and I'll do my best to respond. Thanks so much for watching, and I'll see you in the next video. Bye.